Pre-examination processes. 7.2.1 General. The laboratory shall have procedures for all pre-examination activities and make them accessible to relevant personnel. Note 1. The pre-examination processes can influence the outcome of the intended examination. Note 2. ISO 20658 provides detailed information for sample collection and transport. Note 3. ISO 2086-1, ISO 2186-2, ISO 2186-3, ISO 2166, all parts. ISO 2184, all parts, ISO 23118, and ISO 4307 provide detailed information for samples from particular sources and for specific analytes. However, the accuracy and reliability of these tests hinge on a critical aspect that often remains unseen by the patient, the pre-examination process. Imagine a medical test as a complex puzzle. The actual analysis of the blood sample, tissue, or other specimen represents just one piece. Before this analysis can occur, a series of meticulous steps must be taken, each one crucial to ensuring the integrity and accuracy of the final result. This intricate sequence of events, encompassing everything from patient preparation to sample handling, constitutes the pre-examination process. The importance of this process cannot be overstated. Just as a flawed foundation can compromise the stability of an entire building, errors or oversights in the pre-examination phase can have a cascading effect, leading to inaccurate test results and potentially incorrect medical decisions. These inaccuracies can have significant consequences for patients, ranging from unnecessary anxiety and repeated tests to delayed or inappropriate treatment. In essence, the pre-examination process lays the groundwork for reliable medical testing. It is a complex interplay of procedures, protocols, and human expertise, all working in unison to ensure that the journey from sample collection to test result is as accurate and reliable as possible. By understanding and optimizing this process, we can enhance the quality of healthcare delivery and ultimately improve patient outcomes. 7.2.2 Laboratory information for patients and users. The laboratory shall have appropriate information available for its users and patients. The information shall be sufficiently detailed to provide laboratory users with a comprehensive understanding of the laboratory's scope of activities and requirements. The information shall include, as appropriate, A. The locations of the laboratory, operating hours, and contact information. B. The procedures for requesting and the collection of samples. C. The scope of laboratory activities and time for expected availability of results. D. The availability of advisory services. E. Requirements for patient consent. F. Factors known to significantly impact the performance of the examination or the interpretation of the results. G. The laboratory complaint process. Laboratories are highly regulated settings, held to rigorous standards designed to ensure the accuracy, reliability, and safety of all testing procedures. These standards encompass a wide range of factors, from personnel qualifications and equipment maintenance to quality control measures and data management protocols. One of the key aspects of laboratory regulation is accreditation. Accreditation bodies, such as the College of American Pathologists or the Joint Commission, establish comprehensive standards that laboratories must meet to demonstrate their competence and commitment to quality. These standards cover all aspects of laboratory operations, ensuring that tests are performed accurately, reliably, and consistently. Beyond accreditation, laboratories adhere to strict quality control procedures to monitor and maintain the accuracy and precision of their testing methods. This includes using calibrated instruments, running regular quality control samples, and participating in proficiency testing programs, where laboratories analyze and compare their results for specific tests with other laboratories. The physical environment of the laboratory is also tightly controlled. Temperature, humidity, and air quality are carefully monitored and regulated to prevent contamination and ensure the stability of reagents and samples. Laboratories are also designed to minimize the risk of cross-contamination, with designated areas for specific tasks and strict protocols for handling potentially infectious materials. In essence, the laboratory environment is a carefully controlled ecosystem designed to minimize variability and maximize the accuracy and reliability of test results. By adhering to these stringent standards, laboratories provide the foundation for trustworthy pre-examination processes and ultimately accurate and meaningful medical test results. 7.231 General A. Each request accepted by the laboratory for examinations shall be considered an agreement. B. The examination request shall provide sufficient information to ensure unequivocal traceability of the patient to the request and sample, identity and contact information of requester, identification of the examinations requested, informed clinical and technical advice, and clinical interpretation can be provided. C. The examination request information may be provided in a format or medium as deemed appropriate by the laboratory and acceptable to the user. D. Where necessary for patient care, the laboratory shall communicate with users or their representatives to clarify the user's request. 7.2.3.2 Oral requests. The laboratory shall have a procedure for managing oral requests for examinations, if applicable, that includes the provision of documented confirmation of the examination request to the laboratory within a given time. This includes everything from basic test descriptions and patient preparation instructions to more detailed information on test limitations and potential interfering factors. For patients, clear and concise information is crucial for understanding the purpose of a test, what to expect during the collection process, and how to interpret the results. This information empowers patients to actively participate in their healthcare and make informed decisions. It also helps to alleviate anxiety and ensure that patients are adequately prepared for their tests. Healthcare providers, on the other hand, require more detailed information to select the appropriate tests, interpret results accurately, and provide optimal patient care. This includes information on test methodology, analytical sensitivity and specificity, potential sources of error, and reference ranges for interpreting results. To facilitate this exchange of information, laboratories often provide a range of resources, including test catalogs. These comprehensive catalogs list all the tests offered by the laboratory, along with detailed descriptions, specimen requirements, collection instructions, and turnaround times. Patient education materials, such as brochures, pamphlets, and online resources, provide patients with easy-to-understand information about specific tests, including the purpose of the test, how to prepare, what to expect during and after the procedure, and how to interpret the results. Online portals are another valuable resource. Many laboratories now offer secure online portals that allow healthcare providers to order tests, track the status of orders, and access test results electronically. These portals may also provide access to additional resources, such as test interpretations and clinical guidelines. By providing clear, accurate, and accessible information, laboratories play a vital role in ensuring that both patients and healthcare providers are well informed and equipped to make the best possible decisions regarding laboratory testing. 7.241 General. The laboratory shall have procedures for the collection and handling of primary samples. Information shall be available to those responsible for sample collection. Any deviation from the established collection procedures shall be clearly recorded. The potential risk and impact on the patient outcome of acceptance or rejection of the sample shall be assessed, recorded, and shall be communicated to the appropriate personnel. The laboratory shall periodically review requirements for sample volume, collection device, and preservatives for all sample types as applicable, to ensure that neither insufficient nor excessive amounts of sample are collected, and samples are properly collected to preserve the analyte. T7.2.4.2 Information for pre-collection activities. The laboratory shall provide information and instructions for pre-collection activities with sufficient detail to ensure that the integrity of the sample is not compromised. This shall include A. Preparation of the patient, e.g., instructions to caregivers, sample collectors and patients. B. Type and amount of the primary sample to be collected with descriptions of the containers and any necessary additives, and when relevant, the order of collecting samples. C. Special timing of collection where relevant. D. Provision of clinical information relevant to or affecting sample collection, examination performance or result interpretation, e.g., history of administration of drugs. E. Sample labeling for unequivocal identification of the patient, as well as source and site of sample, and labeling when several samples from the same patient are to be collected, including multiple pieces of tissue or slides. F. The laboratory's criteria for acceptance and rejection of samples specific to the examinations requested. 7.2.4.3 Patient consent. A. The laboratory shall obtain the informed consent of the patient for all procedures carried out on the patient. Note: for most routine laboratory procedures, consent can be inferred when the patient willingly submits to the sample collecting procedure, for example, venipuncture. B. Special procedures, including more invasive procedures or those with an increased risk of complications to the procedure, may need a more detailed explanation and, in some cases, recorded consent. C. If obtaining consent is not possible in emergency situations, the laboratory may carry out necessary procedures, provided they are in the patient's best interest. 7.2.4.4 Instructions for collection activities. To ensure safe, accurate, and clinically appropriate sample collection and pre-examination storage, the laboratory shall provide instructions for A. Verification of the identity of the patient from whom a primary sample is collected. B. Verification and, when relevant, recording that the patient meets pre-examination requirements, e.g., fasting status, medication status, time of last dose, cessation, sample collection at predetermined time or time intervals. C. Collection of primary samples with descriptions of the primary sample containers and any necessary additives, as well as the order of sample collection where relevant. D. Labeling of primary samples in a manner that provides an unequivocal link with the patients from whom they are collected. E. Recording of the identity of the person collecting the primary sample and the collection date, and, when relevant, recording of the collection time. F. Requirements for separating or dividing the primary sample when necessary. G. Stabilization and proper storage conditions before collected samples are delivered to the laboratory. H. Safe disposal of materials used in the collection process. 7.2.5 Sample transportation. A. To ensure the timely and safe transportation of samples, the laboratory shall provide instructions for 1. Packaging of samples for transportation. 2. Ensuring the time between collection and receipt in the laboratory is appropriate for the requested examinations. 3. Maintaining the temperature interval specified for sample collection and handling. 4. Any specific requirements to ensure integrity of samples, e.g. use of designated preservatives. B. If the integrity of a sample has been compromised and there is a health risk, the organization responsible for the transport of the sample shall be notified immediately and action taken to reduce the risk and to prevent recurrence. C. The laboratory shall establish and periodically evaluate adequacy of sample transportation systems. The specific names of the tests being ordered, relevant medical history, current symptoms, suspected diagnosis, and any medications the patient is taking, and billing information, like insurance details or other payment information. Once the laboratory receives the test request, it is reviewed for completeness and accuracy. Any discrepancies or missing information are addressed with the ordering provider before the test is scheduled or performed. This step is crucial for preventing delays, ensuring that the correct test is performed, and minimizing the risk of errors. After the request is verified, the laboratory assigns a unique identification number to the specimen, linking it to the patient and the specific tests ordered. This number is crucial for maintaining accurate records, tracking the specimen throughout the testing process, and ensuring that the results are correctly matched to the patient. The laboratory then enters the test request into its laboratory information system, a sophisticated software system that manages all aspects of laboratory operations, from order entry and specimen tracking to result reporting and quality control. The laboratory information system plays a critical role in ensuring the efficiency, accuracy, and reliability of the entire testing process. The journey of a laboratory test request, though seemingly straightforward, is a carefully choreographed process that sets the stage for the subsequent steps involved in ensuring accurate and timely test results. By adhering to standardized procedures and leveraging technology like the laboratory information system, laboratories can streamline this process, minimize errors, and optimize the flow of information between healthcare providers, patients, and the laboratory. Section 5. The first step, collecting and handling patient samples. The collection and handling of patient samples constitute a critical juncture in the pre-examination process, as any error or deviation from established protocols at this stage can compromise the integrity of the sample and, consequently, the accuracy of the test results. Whether it's blood, urine, tissue, or another type of specimen, meticulous attention to detail during collection and handling is paramount. The first step in sample collection is patient identification. This seemingly simple step is crucial for preventing misidentification errors, which can have significant consequences for patient safety and care. Healthcare professionals must follow a two-identifier system, typically verifying the patient's name and date of birth against their identification bracelet and the test requisition form. Once the patient's identity is confirmed, the healthcare professional proceeds with collecting the sample using the appropriate technique and equipment. The specific procedures vary depending on the type of sample being collected. For instance, blood collection requires using sterile needles and collection tubes with specific additives, while urine collection may involve providing the patient with sterile containers and instructions for obtaining a clean catch midstream specimen. After collection, the sample is immediately labeled with the patient's identifying information, the date and time of collection, and any relevant additional information, such as the type of specimen or the tests ordered. This labeling should be done in the presence of the patient to minimize the risk of errors. The next step involves handling the specimen with care to prevent contamination or degradation. This may include placing the sample in a biohazard bag, maintaining the sample at a specific temperature, or protecting it from light exposure. The specific handling requirements depend on the nature of the sample and the tests being performed. Proper sample collection and handling are paramount for ensuring the reliability of laboratory test results. By adhering to standardized procedures, using appropriate equipment and techniques, and maintaining meticulous attention to detail, healthcare professionals play a vital role in safeguarding the integrity of patient samples and contributing to the accuracy of the diagnostic process. Section 6. Respecting patient autonomy. The importance of informed consent. In the realm of healthcare, respecting patient autonomy is paramount. This principle extends to all aspects of medical care, including laboratory testing. Before any medical procedure, including the collection of samples for laboratory analysis, obtaining informed consent is not merely a legal requirement, but an ethical imperative. Informed consent ensures that patients are active participants in their healthcare decisions, fully aware of the nature of the procedure, its potential benefits and risks, and any available alternatives. In the context of laboratory testing, informed consent involves explaining to the patient the purpose of the test. Why is the test being ordered? What information will it provide? The sample collection procedure. What type of sample will be collected, like blood, urine, or tissue? How will the sample be collected? Will it involve any discomfort or pain? Potential risks and benefits. Are there any risks associated with the sample collection procedure, such as bleeding, infection, or bruising? What are the potential benefits of the test in terms of diagnosis, treatment planning, or monitoring? Alternatives to the test. Are there any alternative tests or procedures that could provide similar information? What are the potential risks and benefits of these alternatives? The right to refuse. Patients have the right to refuse any medical procedure, including laboratory testing. It's important to emphasize that refusal of testing may affect their healthcare management. The process of obtaining informed consent should be an open and honest dialogue between the healthcare provider and the patient. Patients should be encouraged to ask questions and express any concerns they may have. The information provided should be tailored to the patient's level of understanding and cultural background. In certain situations, such as emergencies or when a patient is unable to provide informed consent due to their medical condition, alternative pathways for obtaining consent, such as from a legal guardian or surrogate decision maker, may be necessary. By prioritizing informed consent, healthcare providers demonstrate respect for patient autonomy and foster a trusting patient-provider relationship. This, in turn, contributes to a more ethical and patient-centered approach to healthcare. Section 7. Ensuring sample integrity. Instructions for collection activities. Maintaining the integrity of patient samples throughout the pre-examination process is paramount for ensuring accurate and reliable test results. To achieve this, clear and comprehensive instructions for collection activities are essential. These instructions serve as a roadmap for healthcare professionals, guiding them through each step of the collection process and minimizing the risk of errors or contamination that could compromise the sample. Instruction manuals for sample collection typically include detailed information on the following: patient preparation, specific instructions on how patients should prepare for the test, such as fasting requirements, dietary restrictions, or medication adjustments, specimen type and volume, the exact type of specimen required for the test, for example, serum, plasma, or whole blood, and the minimum volume needed to perform the analysis. Collection containers and additives. The appropriate type of collection container to use for the specific test and any required additives, such as anticoagulants or preservatives, that need to be present in the container. Collection technique. Step-by-step instructions on how to collect the sample, including the site of collection, the angle of needle insertion, and the order of draw for multiple collection tubes. Specimen labeling. Clear guidelines on how to label the specimen container accurately, including the patient's identifying information, date and time of collection, and any relevant additional details. Specimen handling and storage. Instructions on how to handle and store the specimen after collection, including temperature requirements, light sensitivity, and transportation guidelines. These instructions should be readily accessible to all healthcare professionals involved in sample collection and reviewed periodically to ensure compliance with current best practices and laboratory requirements. By providing clear, concise, and comprehensive instructions for collection activities, laboratories play a crucial role in minimizing pre-analytical errors, safeguarding the integrity of patient samples, and ultimately ensuring the accuracy and reliability of laboratory test results. Section 8. Safeguarding samples in transit. Transportation requirements. Once a patient sample has been collected, Its journey to the laboratory for analysis is equally critical in maintaining its integrity and ensuring accurate test results. Proper transportation procedures are essential to safeguard samples from external factors that could affect their quality, such as temperature fluctuations, physical damage, or exposure to light. Transportation protocols for laboratory specimens typically involve a combination of the following: leak-proof packaging. Samples are placed in sealed, leak-proof containers, such as biohazard bags or specialized transport tubes, to prevent leakage and contamination during transport. Temperature control. Maintaining the sample at the correct temperature is crucial for preserving its integrity. This may involve using insulated containers, ice packs, or specialized temperature-controlled transport boxes, depending on the specific temperature requirements of the sample. Protection from shock and vibration. Excessive shaking or impact during transport can damage delicate samples, particularly those containing cells or fragile molecules. To minimize this risk, samples are often cushioned with absorbent materials and transported in dedicated specimen transport boxes designed to withstand shocks and vibrations. Light protection. Some samples, particularly those sensitive to light degradation, may require protection from light exposure during transport. This can be achieved by using opaque containers or wrapping the sample in aluminum foil. Timely delivery. Delays in transport can affect the stability of some samples, leading to inaccurate test results. Laboratories often specify maximum acceptable transport times for different types of specimens. In addition to these general guidelines, specific transportation requirements may apply based on the nature of the sample, the tests being performed, and any applicable regulations, such as those governing the transport of infectious materials. By adhering to stringent transportation protocols, laboratories and healthcare facilities can ensure that patient samples arrive at the laboratory in optimal condition, preserving their integrity and contributing to the accuracy and reliability of the diagnostic process. Section 9. From collection to analysis. Sample receipt and acceptance. The journey of a patient sample culminates in its arrival at the laboratory, where it undergoes a series of procedures to verify its integrity, confirm its identity, and prepare it for analysis. This critical phase, known as sample receipt and acceptance, serves as a final checkpoint before the actual testing process begins, ensuring that only samples meeting strict quality criteria proceed to analysis. Upon arrival at the laboratory, specimens undergo a meticulous accessioning process, which involves verifying patient identification. The laboratory staff carefully checks the patient's identifying information on the specimen container against the accompanying requisition form to ensure a match and prevent misidentification errors. Inspecting the specimen. The integrity of the specimen is assessed, looking for any signs of damage, leakage, or clotting that could compromise the accuracy of the test results. Checking for proper labeling. The specimen container is examined to ensure it is properly labeled with all the required information, including the patient's name, date of birth, collection date and time, and any relevant test-specific details. Verifying specimen type and volume. The laboratory staff confirms that the received specimen matches the type and minimum volume required for the requested tests. Logging the specimen into the LIS. The specimen is assigned a unique identification number and logged into the Laboratory Information System, LLIS, creating a digital record of its arrival and tracking its progress through the testing process. If any discrepancies or issues are identified during the receipt and acceptance process, the laboratory contacts the ordering provider to resolve the issue before proceeding with the analysis. This may involve requesting a new specimen, clarifying missing information, or adjusting the test order based on the condition of the received sample. The sample receipt and acceptance process plays a crucial role in maintaining the quality and reliability of laboratory testing. By implementing rigorous procedures to verify specimen integrity, confirm patient identification, and ensure that all samples meet the laboratory's acceptance criteria. Laboratories contribute to the accuracy and trustworthiness of test results, ultimately supporting informed clinical decision-making. Section 10. Preserving accuracy. The crucial role of proper storage. Once a patient sample has been received and accepted by the laboratory, proper storage becomes paramount in maintaining its stability and ensuring accurate test results. Different types of specimens have unique storage requirements, and adhering to these guidelines is essential to prevent degradation, contamination, or other changes that could interfere with the analytical process. Storage protocols for laboratory specimens typically involve controlling factors such as temperature. Maintaining the correct temperature is crucial for preserving the integrity of many biological samples. Some specimens require refrigeration at temperatures between 2 to 8 degrees Celsius, while others may need to be frozen at much lower temperatures, such as -20 degrees Celsius or -80 degrees Celsius, to prevent degradation. Light exposure. Certain analytes in biological samples are sensitive to light and can degrade upon prolonged exposure. To prevent this, light-sensitive specimens are stored in opaque containers or wrapped in aluminum foil to block out light. Humidity. High humidity levels can promote microbial growth and affect the stability of some samples, while excessively dry conditions can lead to dehydration. Laboratories often control humidity levels in storage areas to maintain an optimal range for specimen preservation. Time. The stability of biological samples deteriorates over time. Laboratories establish specific storage durations for different types of specimens and analytes, beyond which the sample may no longer be suitable for analysis. Laboratories utilize a variety of storage equipment to maintain these controlled environments, including refrigerators, freezers, specialized storage cabinets, and liquid nitrogen tanks for long-term preservation. These storage units are regularly monitored and calibrated to ensure they maintain the required temperature and humidity levels. Proper storage of patient samples is an integral aspect of pre-analytical quality control in the laboratory. By adhering to established storage guidelines, laboratories can minimize pre-analytical errors, preserve the integrity of patient samples, and ensure that test results accurately reflect the patient's clinical condition, ultimately contributing to informed medical decisions and improved patient care.